Welcome to Explain Wise 91. Rocket here. We break down high-yield nursing topics in a way that's simple, clear, and easy to remember. Today, we're diving into basic care and comfort, covering hygiene, mobility, elimination, nutrition, and comfort measures, all the essentials you need for safe, effective patient care. Let's get started. Question 1. A client with limited mobility is at risk for pressure injuries. Which action should the nurse perform first? A. Apply a moisture barrier cream. B. Reposition the client every 2 hours. C. Massage red areas on the sacrum. D. Increase oral protein intake. Correct answer: B. Reposition the client every 2 hours. Rationale: frequent repositioning relieves pressure and is primary prevention. Strategy: preventive measures for pressure injury relieve pressure first. Why others are not correct? A. Moisture barrier is helpful but secondary to pressure relief. C. Massaging red areas can damage tissue and is not recommended. D. Nutrition helps healing but won't immediately relieve pressure. Question 2. A postoperative client needs assistance ambulating for the first time. What is the nurse's priority? I'd encourage the client verbally to walk. B. Assess orthostatic vital signs before ambulation. C. Obtain a wheelchair for transport. D. Teach deep breathing exercises. Correct answer: B. Assess orthostatic vital signs before ambulation. Rationale: hypotension and syncope risk after anesthesia, check safety first. Strategy: safety assessment before mobility activities. Why others are not correct? A. Encouragement alone is unsafe without assessment. C. Wheelchair may be appropriate but first check stability. D. Deep breathing is important but not the priority before ambulation. Question 3. A client with urinary retention has a bladder scan showing 600 milliliters. Which action should the nurse take first? A. Insert a straight catheter. B. Encourage the client to void. C. Offer fluids and continue to observe. D. Notify the provider for orders. Correct answer: A. Insert a straight catheter. Rationale: 600 milliliters retention is significant and requires immediate decompression. Strategy: treat objective findings that indicate acute dysfunction. Why others are not correct? B. Encouragement won't resolve high retention. C. Observation delays needed intervention. D. Don't wait to notify, act per standing catheterization protocols. Question 4. A client complains of nausea and cannot tolerate oral medications. Which route should the nurse use for antiemetic administration? A. Oral immediate release. B. Rectal. C. Intramuscular, IM. D. Subcutaneous. Correct answer: C. Intramuscular, IM. Rationale: IM provides reliable absorption when oral is not possible and rectal may be less reliable. Strategy: choose alternative route ensuring timely effect. Why others are not correct? A. Oral is contraindicated if client is vomiting. B. Rectal absorption can be variable and often slower. D. Subcutaneous may have slower and less predictable absorption. Question 5. A client with diabetes uses sliding scale insulin and has a blood glucose of 320 milligrams per deciliter. What is the nurse's first action? A. Give the prescribed insulin per sliding scale. B. Offer a carbohydrate snack. C. Call the provider for orders. D. Recheck glucose in 4 hours. Correct answer: A. Give the prescribed insulin per sliding scale. Rationale: high glucose requires prompt insulin per standing orders to reduce hyperglycemia. Strategy: follow established protocols for abnormal labs. Why others are not correct. B. Snack would worsen hyperglycemia. C. No need to call if standing orders exist. D. Waiting delays treatment. Question 6. An incontinent client has a new order for an indwelling Foley. Which nursing action is highest priority during insertion? A. Provide privacy with the curtain drawn. B. Maintain sterile technique. C. Secure the catheter to the thigh. D. Document the urine color. Correct answer: B. Maintain sterile technique. Rationale: sterility prevents catheter-associated urinary tract infections, CAUTI. Strategy: prevent infection when performing invasive procedures. Why others are not correct. A. Privacy is important but not the highest safety priority. C. Securing the catheter is required but after insertion. D. Documentation follows safe insertion. Question 7. A client on bed rest has sudden shortness of breath and pleuritic chest pain. What is the nurse's priority action? A. Obtain a chest X-ray. B. Apply oxygen and notify the provider. C. Encourage deep breathing. D. Reposition the client. Correct answer: B. Apply oxygen and notify the provider. Rationale: sudden dyspnea with chest pain may indicate pulmonary embolism. Immediate oxygen and notification is critical. Strategy: stabilize airway/breathing then escalate care. Why others are not correct. A. Imaging is diagnostic but not the immediate nursing action. C. Deep breathing may not be effective and can delay treatment. D. Repositioning alone is insufficient. Question 8. A client with dysphagia needs feeding. Which action reduces aspiration risk? A. Offer thin liquids. B. Place client in high Fowler's position during feeding and 30 minutes after. C. Feed the client rapidly to avoid fatigue. D. Give solids before liquids. Correct answer: B. Place client in high Fowler's position during feeding and 30 minutes after. Rationale: upright positioning minimizes aspiration risk and aids swallowing. Strategy: use positioning and timing to support safe swallowing. Why others are not correct. A. Thin liquids increase aspiration risk for many with dysphagia. C. Rapid feeding increases risk. Question 9. A client has diarrhea and is becoming weak and dizzy. Which lab value should the nurse check immediately? A. Serum sodium. B. Hemoglobin. C. Serum potassium. D. WBC count. Correct answer: C. Serum potassium. Rationale: diarrhea causes potassium loss leading to weakness and dizziness from hypokalemia. Strategy: link presenting symptoms to likely electrolyte disturbances. Why others are not correct. A. Sodium is important but hypokalemia is more likely given symptoms. B. Hemoglobin changes don't acutely present with diarrhea. D. WBC doesn't explain dizziness/weakness acutely. Question 10. A client pulling at their urinary catheter is agitated and disoriented. What is the nurse's immediate intervention? A. Restrain the client to prevent removal. B. Apply a lubricating jelly to the catheter. C. Assess for causes of agitation and provide reorientation. D. Remove the catheter and recatheterize later. Correct answer, C. Assess for causes of agitation and provide reorientation. Rationale, address cause of behavior, ensure safety, and use least restrictive measures first. Strategy, prioritize assessment and non-coercive interventions before restraints. Why others are not correct. A. Restraints are last resort after alternatives. B. Lubricant won't stop pulling behavior. D. Removing catheter may be unsafe and not address agitation cause. Question 11. A client with hypertension reports feeling faint when standing. Which action should the nurse perform first? A. Instruct the client to stand up slowly next time. B. Check orthostatic vital signs. C. Increase the client's fluid intake. D. Notify the provider immediately. Correct answer, B. Check orthostatic vital signs. Rationale, objective measurement confirms orthostatic hypotension which guides treatment. Strategy, validate symptoms with assessment before interventions. Why others are not correct. A. Education is good but first identify the cause. C. Fluid may help but could be contraindicated without assessment. D. Provider may be notified after assessment. Question 12. A client has vomited and reports epigastric pain. Which nursing action is priority? A. Offer a sip of water. B. Perform pain assessment and check vital signs. C. Place the client on NPO status. D. Administer antiemetic. Correct answer, B. Perform pain assessment and check vital signs. Rationale, assessing pain and vitals determines severity and guides immediate interventions. Strategy, assess first to prioritize urgent needs. Why others are not correct. A. Giving water could risk aspiration. C. NPO may be appropriate but follows assessment. D. Antiemetic may be indicated but assessment guides medication choice. Question 13. A client with a nasogastric NG tube reports respiratory distress after reinsertion. What should the nurse do first? A. Remove the NG tube immediately. B. Auscultate breath sounds. C. Check tube placement by aspirating gastric contents. D. Call the provider. Correct answer, A. Remove the NG tube immediately. Rationale, respiratory distress after NG insertion suggests possible misplacement into airway, remove to reduce harm. Strategy, remove potential immediate threat before confirmatory checks. Why others are not correct. B/C, assessments are useful but delay could harm if tube is in airway. D, provider should be notified after ensuring immediate safety. Question 14. A client on a low-sodium diet asks which snack is best. Which choice should the nurse recommend? A. Salted crackers. B. Fresh apple. C. A canned soup. D. Processed cheese. Correct answer, B. Fresh apple. Rationale, fresh fruits are low in sodium and suitable for low-sodium diets. Strategy, choose whole, unprocessed foods for sodium restriction. Why others are not correct. A, C, D. Processed foods and salted items usually have high sodium. Question 15. A client with constipation is scheduled for an enema. Which position should the nurse place the client in for administration? A. Supine. B. Left lateral, SIMS, position. C. High Fowler's. D. A prone. Correct answer, B. Left lateral, SIMS, position. Rationale: SIMS position facilitates flow into the sigmoid colon and is standard for enemas. Strategy: use correct positioning to maximize procedure effectiveness and comfort. Why others are not correct. A, C, D. These positions are not optimal for enema administration. Question 16. A client needing frequent repositioning is scheduled for physical therapy. Which plan best supports skin integrity? A. Delay repositioning until after therapy. B. Reposition every 2 hours in addition to therapy schedule. C. Reposition only if redness develops. D. Use pillows only, no repositioning. Correct answer, B. Reposition every 2 hours in addition to therapy schedule. Rationale: regular repositioning prevents pressure injuries even with therapy sessions. Strategy: preventive continuous care, not reactive. Why others are not correct. A. Delay increases risk. C. Waiting for redness is reactive and unsafe. D. Pillows alone are insufficient. Question 17. A client with a nasogastric suction reports suction tubing is clogged. What is the nurse's immediate action? A. Irrigate the tube per facility protocol. B. Replace the NG tube. C. Place the suction to low intermittent. D. Encourage the client to cough. Correct answer, A. Irrigate the tube per facility protocol. Rationale: proper irrigation restores patency while following protocol to avoid complications. Strategy: use standardized procedure first to resolve mechanical issues. Why others are not correct. B. Replacement may be required if irrigation fails. C. Adjusting suction without addressing clog won't clear tube. D. Coughing is unlikely to remove internal tube obstruction. Question 18. A client on thickened liquids is given thin coffee by mistake and coughs while drinking. What is the nurse's priority? A. Document the error. B. Assess for coughing and respiratory compromise and perform suctioning if needed. C. Offer water to clear the airway. D. Report the event to the manager only. Correct answer, B. Assess for coughing and respiratory compromise and perform suctioning if needed. Rationale: aspiration risk requires immediate assessment and airway management. Strategy: prioritize airway safety after potential aspiration. Why others are not correct. A. D. Reporting comes after addressing immediate risk. C. Offering water could worsen aspiration. Question 19. A client with severe diarrhea is showing signs of confusion and low blood pressure. Which is the nurse's first action? A. Start oral rehydration solution. B. Obtain orthostatic vital signs and establish for access. C. Encourage the client to ambulate. D. Give antidiarrheal medication. Correct answer, B. Obtain orthostatic vital signs and establish for access. Rationale: suspected hypovolemia requires rapid assessment and 4 fluids for stabilization. Strategy: stabilize circulation before non-urgent measures. Why others are not correct. A. Oral may be inadequate with hypotension/confusion. C. Ambulation risks fainting. D. Antidiarrheal without fluid resuscitation could worsen condition in some causes. Question 20. A client with an ostomy is anxious about self-care at home. What should the nurse include first in teaching? A. How to change the appliance step by step. B. Signs of infection or complication and when to seek help. C. Nutritional restrictions. D. Cost comparison of pouching systems. Correct answer: B. Signs of infection or complication and when to seek help. Rationale: safety information and when to seek care is priority for home readiness. Strategy: teach safety and warning signs before technical skills. Why others are not correct. A. Important but secondary to safety information. C. Nutrition is relevant but not the initial priority. D. Cost discussions are not primary teaching content for safe self-care. Question 21. A frail elderly client is prescribed a bath every other day but reports itching and odor. What is the best nursing action? A. Increase bath frequency and use gentle soap. B. Use alcohol-based wipes for cleansing. C. Avoid bathing to prevent skin tears. D. Refer to dermatology immediately. Correct answer: A. Increase bath frequency and use gentle soap. Rationale: more frequent gentle hygiene can relieve odor and itching while protecting skin. Strategy: balance hygiene needs with skin integrity. A just plan is needed. Why others are not correct. B. Alcohol-based wipes can dry and irritate fragile skin. C. Avoiding hygiene is not appropriate for odor/itching. D. Dermatology referral may be needed later but basic hygiene should be addressed first. Question 22. A client with acute urinary retention is restless and diaphoretic. Which intervention is priority? A. Offer reassurance. B. Insert an indwelling catheter per order. C. Run warm water over perineum. D. Encourage ambulation. Correct answer: B. Insert an indwelling catheter per order. Rationale: retention causing autonomic symptoms needs immediate decompression. Strategy: address physiologic emergency promptly. Why others are not correct. A, C, D. These are comfort measures but do not relieve retention. Question 23. A client receiving enteral tube feedings develops abdominal distension and vomiting. What is the nurse's first action? A. Stop the feeding and assess bowel sounds and residual. B. Increase feeding rate to clear stomach contents. C. Turn client to the left side. D. Administer antiemetic and continue feeding. Correct answer: A. Stop the feeding and assess bowel sounds and residual. Rationale: stop feeding to prevent aspiration and evaluate for intolerance or obstruction. Strategy: halt potential harm and assess before continuing. Why others are not correct. B. Increasing rate worsens intolerance. C. Position change may be helpful but assessment is priority. D. Medication before assessment may mask worsening condition. Question 24. A client has a new order for a urinary culture and sensitivity. Which action should be taken first? A. Collect a midstream clean catch specimen. B. Start antibiotics immediately. C. Document the order. D. Apply antiseptic to the catheter insertion site. Correct answer. A. Collect a midstream clean catch specimen. Rationale. Obtain specimen before antibiotics to ensure accurate culture results. Strategy. Collect diagnostic specimens prior to treatment when possible. Why others are not correct. B. Starting antibiotics before cultures can yield false negatives. C. Documentation is required but not the clinical priority. D. Not relevant if specimen is midstream. Question 25. A client with dementia wets the bed nightly. Which intervention best promotes continence and dignity? A. Use adult briefs only at night. B. Provide scheduled toileting during the day and before bedtime. C. Limit fluids after 6 p.m. without checking hydration. D. Ignore and change linens in the morning. Correct answer. B. Provide scheduled toileting during the day and before bedtime. Rationale. Scheduled toileting reduces incontinence episodes while maintaining dignity. Strategy. Use behavioral interventions before relying solely on absorbent products. Why others are not correct. A. Briefs may be needed but do not address cause. C. Fluid restriction can cause dehydration if not managed properly. D. Reactive care ignores prevention. Question 26. A client on a low-residue diet for bowel rest asks what they can eat. Which item is appropriate? A. Fresh berries. B. White rice. C. Bran cereal. D. Popcorn. Correct answer. B. White rice. Rationale. Low-residue diets favor low-fiber, easily digested foods like white rice. Strategy. Recommend low-fiber, low-residue options for bowel rest. Why others are not correct. A, C, D. High-fiber foods increase residue. Question 27. A client with impaired mobility is scheduled for an exercise program. Which safety measure should the nurse implement first? A. Teach the client how to stretch. B. Ensure appropriate assistive devices and gait belt are available. C. Ask the client to exercise alone to promote independence. D. Start with high-intensity exercises to build strength quickly. Correct answer. B. Ensure appropriate assistive devices and gait belt are available. Rationale. Safety equipment prevents falls during mobility training. Strategy. Mitigate fall risk before exercise. Why others are not correct. A. Teaching is needed but equipment is primary for safety. C. Exercising alone is unsafe for those with impaired mobility. D. High intensity is unsafe initially. Question 28. A client has an ileostomy and reports frequent watery output and peristomal skin irritation. Which nursing intervention is most important? A. Increase high-fiber foods. B. Ensure the pouching system is well fitted and skin is clean/dry before application. C. Apply talcum powder around the stoma. D. Decrease oral fluid intake. Correct answer. B. Ensure the pouching system is well fitted and skin is clean/dry before application. Rationale. Proper fit prevents leakage and skin irritation. Skin care is essential. Strategy. Address mechanical causes of skin breakdown first. Why others are not correct. A. High fiber may not be tolerated with ileostomy. C. Powder may interfere with adhesion. D. Decreasing fluids risks dehydration. Question 29. A newborn is having poor latch and the mother is concerned about milk supply. Which initial action should the nurse take? A. Recommend formula supplementation. B. Observe a breastfeeding session and provide latch assistance. C. Suggest pumping exclusively. D. Encourage the mother to stop breastfeeding. Correct answer: B. Observe a breastfeeding session and provide latch assistance. Rationale: proper latch technique can improve milk transfer and supply. Strategy: address technique before supplementing. Why others are not correct. A. Supplementation may be needed later but first optimize breastfeeding. C. Pumping may help but not before assessing latch. D. Stopping is not indicated. Question 30. A client with limited mobility complains of foot pain and redness over the heel. What is the nurse's priority action? A. Elevate the foot on a pillow. B. Inspect for pressure injury and implement pressure relief measures. C. Apply heat to the area. D. Encourage ambulation. Correct answer: B. Inspect for pressure injury and implement pressure relief measures. Rationale: redness over bony prominences suggests early pressure injury. Assess and relieve pressure. Strategy: early detection and prevention of skin breakdown. Why others are not correct. A. Elevation may help but targeted pressure relief is needed. C. Heat could worsen tissue injury. D. Ambulation may not be possible and could worsen condition. Question 31. A client with Parkinson's disease has difficulty swallowing pills. What is the safest nursing action? A. Crush all medications and mix with applesauce without checking. B. Consult pharmacy and provider about alternative formulations, liquid, disintegrating. C. Stop medications to avoid aspiration. D. Encourage the client to swallow multiple pills at once. Correct answer: B. Consult pharmacy and provider about alternative formulations, liquid, disintegrating. Rationale: some meds can be altered safely, others cannot. Verify alternatives. Strategy: always verify medication administration alternatives with pharmacy/provider. Why others are not correct. A. Crushing may alter absorption or be contraindicated. C. Stopping meds risks symptom worsening. D. Multiple pills increase aspiration risk. Question 32. A client with impaired mobility requires transfer from bed to chair. Which technique best minimizes risk to nurse and client? A. Use a mechanical lift with trained staff. B. Two-person manual lift without a device. C. Pull the client using the draw sheet alone. D. Ask the client to stand independently. Correct answer: A. Use a mechanical lift with trained staff. Rationale: mechanical lifts reduce injury risk when clients cannot bear weight. Strategy: use assistive devices per safety policies. Why others are not correct. B. Manual lifts risk injury if client is heavy/unable to assist. C. Draw sheet pulling risks skin shearing. D. Unsafe if client cannot stand. Question 33. A client who is NPO after surgery asks when they can have water. What is the nurse's best response? Oh, you can have water whenever you want. B. I'll check the surgeon's orders and your bowel sounds before giving anything. C. You cannot have any fluids today. D. Drink only a sip. Correct answer: B. I'll check the surgeon's orders and your bowel sounds before giving anything. Rationale, post-op oral intake depends on orders and GI function. Strategy, verify orders and clinical readiness before feeding. Why others are not correct. A/D, unsafe without assessments/orders. C, may be unnecessary if cleared. Question 34. A client with an indwelling catheter has urine that is cloudy and foul-smelling. What is the nurse's priority? A. Change the drainage bag only. B. Assess for fever, flank pain, and obtain a urine specimen for culture. C. Increase fluid intake and observe. D. Irrigate the catheter immediately. Correct answer, B. Assess for fever, flank pain, and obtain a urine specimen for culture. Rationale, cloudy, foul urine suggests infection, assess and obtain culture before antibiotics. Strategy, diagnose before initiating targeted therapy. Why others are not correct. A. Bag change alone doesn't address infection. C. Hydration is supportive but not diagnostic. D. Routine irrigation is not first line and may introduce infection. Question 35. A client with chronic constipation is prescribed a stimulant laxative PRN. Which teaching point is most important? I. Take the laxative daily for best effect. B. Use only for short-term relief and combine with diet/exercise changes. C. Continue to ignore bowel habits. D. Decrease fluid intake to avoid loose stools. Correct answer, B. Use only for short-term relief and combine with diet/exercise changes. Rationale, stimulant laxatives can cause dependence, non-pharmacologic measures are essential. Strategy, promote safe, sustainable bowel management. Why others are not correct. A. Daily stimulant use risks dependence. C/D, unsafe advice. Question 36. A client receiving total parenteral nutrition, TPN, develops a temperature of 38.6 degrees Celsius 101.5 degrees Fahrenheit. What is the nurse's immediate action? A. Slow the TPN rate. B. Clamp the TPN and obtain blood cultures, notify the provider. C. Continue TPN and recheck temperature in 1 hour. D. Give acetaminophen and continue. Correct answer, B. Clamp the TPN and obtain blood cultures, notify the provider. Rationale, fever suggests catheter-related bloodstream infection, stop infusion in culture before antibiotics. Strategy, prevent further risk and enable accurate diagnosis. Why others are not correct. A. Slowing doesn't remove potential source. C/D, delays appropriate investigation and treatment. Question 37. A client with hearing impairment is receiving instructions for wound care. Which approach best ensures understanding? A. Speak louder and faster. B. Use written instructions, demonstrations, and return demonstration. C. Rely on family to explain. D. Skip teaching to save time. Correct answer, B. Use written instructions, demonstrations, and return demonstration. Rationale, multimodal teaching improves comprehension for sensory deficits. Strategy, teach using methods matched to client needs and verify understanding. Why others are not correct. A. Louder/faster is ineffective. C. Family may help but nurse must ensure client understanding. D. Inadequate care. Question 38. A postoperative client reports severe incisional pain unrelieved by oral meds. The client is diaphoretic and pale. What should the nurse do first? A. Give another oral dose. B. Assess vital signs and the incision for bleeding or dehiscence. C. Tell the client to rest. D. Apply heat to the incision. Correct answer, B. Assess vital signs in the incision for bleeding or dehiscence. Rationale, signs suggest possible complication, bleeding/infection, requiring immediate assessment. Strategy, evaluate for causes of acute pain and instability before symptomatic treatment. Why others are not correct. A. Additional meds without assessment could mask worsening condition. C/D. Not appropriate for acute, possibly surgical complications. Question 39. A client on bed rest complains of calf pain and swelling. Which nursing action is priority? A. Encourage ambulation immediately. B. Measure calf circumference and notify the provider, avoid ambulation. C. Apply warm compress and continue routine care. D. Massage the calf. Correct answer, B. Measure calf circumference and notify the provider, avoid ambulation. Rationale, suspected deep vein thrombosis, DVT, ambulation could dislodge clot leading to pulmonary embolism. Strategy, assess and restrict activity pending diagnosis. Why others are not correct. A. Ambulation risks embolization. C/D. Massaging or warmth may worsen clot risk, not first line. Question 40. A client with decreased appetite is losing weight. Which nursing intervention best promotes adequate nutrition? A. Offer frequent small, nutrient-dense meals and involve dietitian. B. Restrict oral intake to mealtimes only. C. Force the client to finish full meals. D. Offer only clear liquids. Correct answer, A. Offer frequent small, nutrient-dense meals and involve dietitian. Rationale, small, calorie-dense meals increase intake tolerance. Dietitian tailors plan. Strategy, use individualized, realistic interventions to improve nutrition. Why others are not correct. B/C/D, restrictive or coercive approaches are inappropriate. Question 41. A client with frequent nighttime incontinence is awakened hourly devoid but still has episodes. What is the best next step? A. Start an indwelling catheter. B. Evaluate for nocturia causes, meds, fluid intake, urinary infection, and consider bladder training. C. Use adult briefs and stop toileting. D. Increase evening fluids. Correct answer, B. Evaluate for nocturia causes, meds, fluid intake, urinary infection, and consider bladder training. Rationale, identify reversible causes and use behavioral interventions before invasive measures. Strategy, assess underlying contributors to design targeted interventions. Why others are not correct. A. Catheterization carries infection risk and is last resort. C. Briefs without evaluation are passive. D. Increasing fluids worsens nocturia. Question 42. A client on a liquid diet after facial surgery wants to brush teeth. What is the safest recommendation? A. Use a regular toothbrush and vigorous brushing. B. Use an antiseptic mouth rinse and a soft toothbrush gently. C. Avoid oral care entirely for 24 hours. D. Use toothpick to clean teeth. Correct answer, B. Use an antiseptic mouth rinse and a soft toothbrush gently. Rationale, gentle oral care prevents infection and maintains hygiene without trauma. Strategy, balance oral hygiene with surgical precautions. Why others are not correct. A. Vigorous brushing risks trauma. C. Poor oral care increases infection risk. D. Toothpicks can injure gums. Question 43. A client with a fecal impaction is having small liquid stools and abdominal cramping. What should the nurse do first? A. Administer a fleet enema per order. B. Manually remove the impaction immediately. C. Encourage a high-fiber diet. D. Obtain an abdominal X-ray. Correct answer: A. Administer a fleet enema per order. Rationale: enema is a standard initial intervention for impaction when ordered and client stable. Strategy: use ordered, less invasive measures before manual removal. Why others are not correct? B. Manual removal may be needed if enema fails but is more invasive. C. Diet changes are long-term, not immediate. D. Imaging may be used if diagnosis uncertain, but enema is usually first if ordered. Question 44. A client with a tracheostomy is coughing and producing copious secretions. Which action is priority? A. Suction the tracheostomy using sterile technique. B. Encourage the client to cough more forcefully. C. Increase room humidity. D. Call respiratory therapy only. Correct answer: A. Suction the tracheostomy using sterile technique. Rationale: copious secretions can obstruct airway, suctioning restores airway patency. Strategy: maintain airway clearance promptly using proper technique. Why others are not correct? B. Coughing may be insufficient. C. Humidification helps but is slower. D. Immediate suctioning should not be delayed. Question 45. An older adult with poor dentition is refusing dentures and has reduced intake. Which intervention best addresses nutrition? A. Offers soft, nutrient-dense foods and involved dental services. B. Force the client to wear dentures. C. Provide only liquids. D. Ignore and monitor weight weekly. Correct answer: A. Offers soft, nutrient-dense foods and involved dental services. Rationale: accommodate chewing ability while addressing dentition professionally. Strategy: combine immediate practical solutions with long-term fixes. Why others are not correct? B. Coercion is inappropriate. C. Liquids alone may not meet nutritional needs. D. Passive monitoring risks malnutrition. Question 46. A postoperative client reports inability to void 8 hours after surgery. Which is the nurse's first action? A. Offer warm water over perineum and provide privacy to attempt voiding. B. Insert an indwelling catheter immediately. C. Document the finding and recheck in 12 hours. D. Restrict oral fluids. Correct answer: A. Offer warm water over perineum and provide privacy to attempt voiding. Rationale: non-invasive measures often successful, catheterization after attempts or per order. Strategy: try least invasive measures first while monitoring. Why others are not correct? B. Catheterization is indicated if non-invasive measures fail or per protocols. C. Waiting 12 hours delays care. D. Restricting fluids could worsen retention. Question 47. A client on bed rest is scheduled for frequent assisted range of motion (ROM) exercises. What is a nursing priority during ROM? A. Move joints quickly to build strength. B. Support the joint and move within pain-free range while observing for resistance. C. Force full ROM regardless of client discomfort. D. Only perform ROM once daily. Correct answer, B. Support the joint and move within pain-free range while observing for resistance. Rationale: safe ROM maintains mobility while preventing injury and respecting pain limits. Strategy: gentle, supportive technique and client feedback guide ROM. Why others are not correct. A. C. Speed or force can injure. D. Frequency should be individualized, once daily may be insufficient. Question 48. A client with nasogastric tube feeding develops hypoglycemia when the feeding is interrupted. Which action should the nurse take first? A. Provide a glucose-containing solution, juice or D50 per protocol, and reassess. B. Resume tube feeding immediately at full rate. C. Call provider only. D. Document and monitor. Correct answer: I'd provide a glucose-containing solution, juice or D50 per protocol, and reassess. Rationale: immediate treatment of hypoglycemia is critical to prevent neurologic injury. Strategy: treat life-threatening metabolic derangements first. Why others are not correct. B. Resuming feeding may not rapidly correct hypoglycemia. C/D. Delay dangerous. Question 49. A client with advanced COPD complains of increased work of breathing while eating. What is the safest intervention to promote adequate nutrition? I'd encourage small, frequent meals and rest before eating. B. Force large meals to maintain weight. C. Allow only liquids. D. Increase the pace of feeding. Correct answer: I encourage small, frequent meals and rest before eating. Rationale: small meals reduce dyspnea during eating and conserve energy. Strategy: tailor nutrition plan to respiratory limitations. Why others are not correct. B. Large meals increase dyspnea. C. Liquids alone may not provide adequate calories. D. Faster eating increases aspiration risk. Question 50. A client on continuous bladder irrigation reports bladder spasms and decreased outflow. What should the nurse do first? A. Check for kinks or obstruction in the tubing and irrigate per protocol if prescribed. B. Increase the irrigation rate. C. Remove the catheter. D. Tell the client to bear down. Correct answer: I check for kinks or obstruction in the tubing and irrigate per protocol if prescribed. Rationale: decreased outflow often results from mechanical obstruction. Resolve this first to prevent retention and bladder distension. Strategy: assess and correct mechanical causes before other actions. Why others are not correct. B. Increasing rate when outflow is obstructed worsens pressure. C. Removing catheter may not be indicated and could cause bleeding. D. Bearing down won't clear tubing obstruction. Thanks for watching Explain Why's 91. Lightbulb. If you found this video helpful, don't forget to like, share, and subscribe. Hit the bell icon to never miss a high-yield nursing update. Keep learning, keep growing, and stay wise with Explain Why's 91.